I was told as a medical student that there's this new disease that's been described, the autism, and you might see it once in your career. Was all common disorders are a combination of genetic factors and environmental factors. I mean, everything, high blood pressure, asthma, diabetes, cancer, it doesn't matter what it is, heart disease, stroke, they're all a combination of multiple genetic factors. They tend to run in families, and environmental factors. I mean, the way that you live makes a difference. And autism is no different than that. Autism does have a higher genetic component than any of the other common disorders. That doesn't mean that it's not treatable in any way. As a geneticist, I try to determine the genetic component in my patient and then use that to come up with a personalized medicine approach to treat that individual. I mean, most of the centers are finding about 20% or so that they can find a genetic cause, which is much better. It used to be a few percent when I started. But I do whole genome sequencing and trios. That means both biological parents and the individual. And in that, I can find the genetic cause about 75% of the time.
Really?
Yeah, yeah, it's that high now. Not every case, but about 75%.
Wow. And are you testing the parents also, or like, is there a way to find out where it came from?
Well, you have to test the parents because most of the genetic causes that I find are de novo mutations. That's just new in Latin. It's not in either parent. And so the way that's done is we have the entire sequence. This is all 3 billion nucleotides, so your entire DNA sequence.
What, the de novo, what is that? Explain that.
It just means new in Latin. It's a new mutation. It was
Oh, it's
not
just a
present
new, oh, okay. I understand.
new
Okay.
mutation. Yeah, most of autism is genetic, but it's not inherited. It's a new mutation, not in the parents.
So where would that come from?
Where, I mean, all the chemicals and everything were polluting our environment, I presume. Most of these occur in spermatogenesis. That's the formation of the sperm cells. They probably happened in the father, maybe even when the father was a baby or a child, decades earlier. But they 90% do occur on the male line. And those modifying genes are particularly important because sometimes the main mutation is not treatable, but the modifying genes are treatable. And so that's why I do whole genome sequence. Even when I find it, I don't stop. I go through the whole thing because I may find something that's treatable and the 90% through.
Right.
The ones that are very high functioning, they tend to have genetic components that come from both parents. And the ones that are very low functioning tend to be a de novo mutation from neither parent. But the ones in the middle can be both or either or
Right.
something else.
Right. Yeah. And at least if we keep them all under the autism umbrella, then they can all get the help that they need.